Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer and Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, our guest today is Dr. Jim Sallis. Dr. Jim Sallis is a Ph.D. Distinguished Professor Emeritus of Family Medicine and Public Health at the University of California in San Diego. You can find out more about Dr. Jim Sallis and his wonderful work on his website, drjimsallis.org. Welcome, Dr. Sallis.
Thank you so much, Catherine.
Now, we're going to be talking about a subject that everyone all over the world is trying to figure out right now, which is how can I prevent myself from getting coronavirus, in addition to wearing masks and public distancing? How can I keep myself healthy enough? And if I get coronavirus, how can I recover more quickly? So Dr. Jim Sallis, although people are well acquainted with the many health benefits of being physically active, we've not heard much about physical activity benefits as they relate to the COVID-19 pandemic. Could you summarize what we know about the benefits?
Yes, I'd be happy to. This is something I've just learned about through a lot of detailed reading because it's not well known. So let me give you evidence that we have about how physical activity is relevant for COVID-19. And it begins with that when the virus enters the body responds by mobilizing the immune system and attacking the virus. And often that creates, that conflict creates inflammation. Well, it turns out that being physically active at a moderate level, like walking, boosts the functioning of the immune system in several ways and decreases inflammation. So we would expect that in at least some cases, people who are infected by the virus who are physically active would then go on to have less severe cases. So that's just number one. Number two is almost all the deaths, certainly in the United States and probably elsewhere, occurred in people that, yes, were generally older, but also virtually all of them had some kind of existing chronic disease. And almost all of these chronic diseases are things that we know physical activity helps with: hypertension, obesity, diabetes, heart disease. All of those are strongly affected by physical activity. So if as a world, people were more active, we would expect to have fewer deaths from this virus. Third thing, I'll lump a couple of things together. Because of the pandemic and the economic turmoil and the social isolation, virtually everybody in the world is at stress. They're under stress. Well, what is one of the most effective prevention and treatment strategies for stress? Of course, physical activity. And that impact on stress is both psychological and physiological. So when you're under stress, your body's hormone cortisol gets out of balance with other hormones. But physical activity brings that back into balance. And cortisol, when it's out of balance, is interfering with your immune system and your inflammation responses. So another pathway to get there. The last one that I will mention is probably the most timely and maybe the most significant. It's hard to say. And this is really not known very well at all. Because physical activity helps boost the immune system, it also helps older adults have a stronger and more effective response to vaccines. So we're all hoping for vaccines. But if they're not as effective as they could be, then that will be a problem. And this is especially important for older adults because as we age, our immune system becomes less effective. And it's called immunosenescence. Your immune system is getting sleepy. All right. So physical activity wakes it up. This is a message I'm trying to get out, not just to the public so people can be prepared to have the best response whenever we get access to vaccines, but also I'm trying to get to the scientists that are doing the vaccine trials so that they can add an element to their studies to determine strictly whether older adults do better with vaccines if they're active. So I think that's quite a basket full of benefits that are relevant.
Dr. Jim Sallis, your message, I feel, is so critical because, as you said, so many people around the world were all hoping for a vaccine that could possibly protect us. And here at the Natural Healing Show, we've interviewed a number of experts about what we can do to boost our immune system. I've written articles about what you can do to boost your immune system. But this message about exercise, I feel, is critical. And you're the only person that I have read has been talking about this. And most of the people I feel are, there are lots of articles, take this vitamin, take this supplement. And I feel very distressed when I read these articles. I personally take lots of supplements myself. However, there are billions of people around the planet who cannot afford, hundreds and hundreds of dollars of supplements every month. And, they, at this point where people have lost their jobs, I think there's 10 million people here in the US who don't have a job, at the moment, or on permanent unemployment, to give people the message that you've got to spend hundreds of dollars on supplements or you're going to, be susceptible to the virus, I think is a very upsetting message. And when we can give an empowering message, which is exercise and exercise to make yourself healthy, I think it's such a critical message. Now, one of the things you talked about was stress reduction. And one of the things that I've written about at length on my website, catherinecarrigan.com, is that during the pandemic, levels of anxiety and depression have quadrupled. So I think that they say that right now in the US, roughly 1/3 of US adults have clinical levels of anxiety and depression. And 2 of my 10 books are about how to heal depression without drugs. So one of the things that we know, research out of Duke University shows that that exercise alone is more effective for treating depression than exercise and antidepressants. So a very interesting study, you probably know, they took 3 groups. One group of depressed people, they gave them antidepressants, they gave them pharmaceutical medications. Another group, they did exercise, and a third group, they did exercise and drugs. And short term, the exercise and the antidepressant groups were about equally well. Long term, the group that only did exercise did better at healing their depression than antidepressants and drugs. So you're nodding your head. So I'm sure you have some additional insights about that.
Well, you talked about one specific study. There are hundreds showing that physical activity is as effective a treatment for depression and anxiety as drugs and psychotherapy. It's as effective as either of those. But you don't hear much about it. I really feel like people in the psychiatry and psychology professions either don't believe it or don't feel comfortable recommending physical activity. But the evidence is not only strong, but it's been there for at least 20 years.
Yeah, 20 years.
Yeah, at least. And really, one important thing about physical activity is that there are both long-term and short-term studies. You mentioned a long-term study that physical activity has the long-term effects better than medication. Well, short-term, every time you're physically active, you feel better. Anxiety goes down, depression goes down every time. So there's these daily effects that people get. And it doesn't only work for treatment, it works for prevention.
Now,
So
I've taught yoga myself for only 25 years. I've taught Qigong for about the same. And one of the things that we know with yoga, for example, yoga raises your levels of GABA. What is GABA? It's a neurotransmitter that calms you. All right. When you have low GABA, you're anxious. And yoga also raises your levels of serotonin. And then we also know about high intensity interval training, what's called HIIT training. That HIIT training literally enlarges your brain. So about 1/3 of your brain is blood vessels. And when you exercise, you increase this circulation. So very powerful. Now let's go back to talking about exercise in our immune system, which is so critical right now when we're all trying to stay healthy and not get COVID. Can you explain for our audience what are cytokines? Okay, how does what happens to our cytokines when we get coronavirus, and how can exercise help with this cytokine response?
well, I'm going to dodge that question a bit because both the immune system and inflammatory systems are really complex. Each of them have multiple moving parts, T cells, natural killer cells, then and I call them cytokines, the cytokines and interleukins. There's many of them. And I'm a psychologist, so this is not my expertise. So I don't want to step in a swamp of talking about all these elements. But what I would say is that one of the elements of the immune system that I know is affected positively is what they call immunosurveillance. So it's those parts of the immune system that are always on the hunt for infections. So we need that right now so that the immune system can find the virus quickly and signal its partners to come take care of it quickly. So I know that's very important. So so I don't put myself out as an expert on immunity and inflammation, but I feel more like I'm Paul Revere. All right, I'm saying, we need to wake up. Wake up, everybody. There's things that we need to know about to improve our health and safety.
So what you're saying is that exercise basically wakes up our immunosurveillance system so that should we be exposed to coronavirus or any virus, that it's like, all right, danger, Will Robinson, I need to do something.
Yes, exactly. I need to do something, and then that signals other parts of the immune system to come and do their part. And it's very intricate interplay. So your emphasis is natural healing, and so there's nothing more natural than being active. Um, this is something we've done throughout all of our history. And and so it's a natural thing having these systemic changes on these biological processes. And again, not wanting to get into this too much, but that's different than how drugs work.
Mhm.
All right. If you take a drug, it's designed to impact one part of the immune system or one cytokine or interleukin, not the whole system. All right. So physical activity really it builds on the wisdom that our body has accumulated through many thousands of years of evolution, and it takes advantage of that power. And so that to me is the message. Physical activity has a tremendous power to help us. And how strong is that power? In several US and international studies, physical inactivity is listed as the fourth leading underlying cause of death. All right. The fourth, so you could think of that as the fourth most physical activity as the fourth most powerful factor that we have to boost health. So that's how I like to think of it.
Great message, Dr. Jim Sallis. And I totally agree with you, because even when I talk to my clients about the benefits of physical activity and their mood, for example. So let's say you take an antidepressant or an anxiety medication. What's going to go in there and tinker with a few neurotransmitters versus if when you exercise, it literally boosts up all your brain chemistry. So you think more clearly. There's a lot of research about how when you even just go for a walk, you increase the levels of BDNH, which is brain-derived neurotrophin hormone, I think.
Factor, yeah.
Factor.
F or H, either one, yeah.
Yes. So, which helps you literally grow brain cells. Now, let's talk about what types and amounts of physical activity are most effective in creating these benefits for controlling infectious diseases.
Thank you for bringing that up. That's a really important one. And the context here is that physical activity has so many outcomes. It affects virtually every system in the body, but different amounts and doses affect those systems differently. All right. So if you're most interested in boosting your HDL, good cholesterol, you probably need to do some vigorous exercise. But we have a different finding for immune functioning that's kind of interesting. That the optimal amount of physical activity to boost your immune functioning is moderate intensity. And what's the most common, universal, almost moderate intensity activity? Walking. All right. So that's kind of optimal for your immune functioning. And there's a pretty big literature showing that when you do extensive, high intensity activity, not more than just going out for a 20-minute run, but like doing a marathon, that actually suppresses your immune system temporarily. All right. So during the pandemic, maybe not the best time to run marathons. Not that there are marathons being organized. So the dosage is not only important for immune function, it's really good news that all you have to do is go out for a walk or something similar, or go gardening, or for a bike ride, or doubles tennis or something like that. So I think that's really positive news.
Wonderful message. And I agree with you. I've had clients training for marathons and they're literally exercising 5 to 7 hours every day. The stress hormones in their body are just out the roof. Their immune function's way down. Many systems are impacted. Yeah. So let's say somebody's listening to this broadcast and they're like, okay, I'm serious about this. I don't want to spend $800 a month on supplements, but I do want to be healthy and I do want to boost my immune system. As I joke with my clients, if I ran your life, this is what I would have you do. So Dr. Jim Sallis, you're an expert on this. If somebody is listening to this broadcast and wanting to use exercise to boost their immune system, decrease their chances of getting the coronavirus, what would you recommend that they do?
Okay, I'm going to expand that a little bit and say the recommendations I'm about to give, I would like to see public health departments all over the world give the same messages. Because what got me into this topic in the first place is I had just learned all these benefits of physical activity for immune and functioning and inflammation, during the pandemic, and no public health spokespeople, no government official. I couldn't see any physicians on TV telling people about this. And giving people information that is almost certain to help them. All right. So if I ran public health department, this is what I would say. I want to share some good news with you. Something that is very simple and costs nothing can help you protect yourself from viral infections, and reduce the stress, all the stresses from this pandemic. And it's as simple as walking, and that costs nothing, and virtually everybody can do, and can do in a way that you can hopefully enjoy. If walking is not your thing, you can be on a treadmill in your house, or an exercise bike, or you can go biking, or you can go work in the garden. But all you need to do is get your heart rate up a little bit. And ideally, you could do this every day, because every time you're active, you will get those benefits. So work your muscles in some way every day. And this could help reduce the severity of infections, and certainly help people be less stressed, more happy, and more resilient to deal with all of the disruptions that we're all having to go through right now.
Now, I know that here, when we were in absolute lockdown, I would still go for walks every day. And one of the things that we know about coronavirus is that it tends to be airborne. But I felt safe when I was outside going for a walk. So again, practically speaking, again, if you were going to write an exercise prescription during coronavirus, would you have people wear a mask outside? I know what I do is I have a little mask necklace, and when I go for a walk, I have my mask with me. And if a group of people gets too close within 6 feet, I'll put on my mask. But generally, if I'm outside walking, I let myself breathe freely. What do you recommend?
Well, that's the same as I do. I always have my mask, and I'll wear it, some of the time when nobody's around, but usually I just pull it down when nobody is around, because I'm not going to infect anybody and nobody's going to infect me. But when I get close to people, and I don't wait till I get 6 feet, if I'm passing someone on the on the sidewalk or footpath, I will put it up. Or there's a dance that I think people do quite a bit. If somebody's coming the other way on the sidewalk, one of them will go out into the street and create distance that way. And I think that's a very respectful thing to do. So yes, I think it's safer to be outdoors, and you can control how close you are to other people, or you should control how close you are to other people, even outdoors. So, and to me, the other reason to go outdoors, the most important to me is it's more enjoyable. I have a better time on my walk or my bike ride than being in a small room on a treadmill. That's just not my thing. But do whatever works for you. The other thing, of course, is there's evidence that the virus does. It's kind of like a vampire. It does not like sunlight. So going for a walk in the day, it's just so much safer. And more enjoyable. Both are important.
Here at the Natural Healing Show, we've done experts about the healing power of nature. And when you're in trees, let's say you're walking in the woods, there's actual chemicals that get released that lift your mood. And I believe our tree expert said that if you walk in the woods, it takes about 20 minutes and natural antidepressant, just walking in the woods for 20 minutes. Now, going back to our prescription for our audience, obviously people of all different fitness levels and all different ages are going to be listening. How often do you recommend people exercise? And how long do you recommend exercise of this moderate intensity that we can all do in order to keep ourselves healthy and not get coronavirus?
Yep. Excellent questions. And I would start by saying, I think it's preferable to do some activity every day. And, the general recommendation might be around 30 minutes, 20 to 30 minutes. But even if you don't do that every day, do some activity every day. I think we're learning more and more that physical activity benefits don't really usually come at a threshold. You don't have to do more than this to get the benefit. It's seeming now more like every minute counts. You get some benefit from every minute that you're active. So obviously, if you're only active 2 minutes a day, you get a minuscule benefit you probably won't notice. But if you're active 20, 30 minutes, something like that, like I said, every time you're active, you get an immune boost, you get an inflammation control boost, you get a psychological boost. All those things happen each time that you're active. And over time, the official recommendations have changed. And it's no longer you have to do 20 minutes or forget about it. It's now it'd be great to do 20 or 30 minutes a day, but you can accumulate that. You can walk around your house for 5 minutes and then go to the store on a 10-minute walk, and you'll be good. So probably for some health effects and benefits, there's probably thresholds, but for many there aren't. And the more activity you do, the better. And I like to think of it as investment. You can't accumulate benefits if you don't put in the money. All right, you gotta make the investment. And so for physical activity, the investment is time, and time and motion. So that's I would say the requirements, the guidelines are really not that strict. They're guidelines about how to get really excellent benefits across many, many systems in the body.
Now let's talk about recovering from coronavirus. So by now, I personally have worked with a number of clients during coronavirus. It's a horrible illness. You absolutely do not want to get it. You want to do everything you can to avoid it. All these people who say it's just like the flu, it's way worse than the flu. And I've worked with people who've had really bad responses to it. I've also worked with people who didn't even know they had it, and then they took a test and they found out they have antibodies. But even those people who had very little side effects, it definitely affected them. Now, in India, the health ministry has recommended that people who are recovering from coronavirus do two things. Number one, practice breathing exercises, because we know that coronavirus affects your lungs, and also practice yoga. And during this COVID-19 pandemic, I've given away free copies of my book, The Little Book of Breathwork, to people in 17 different countries. So if you would like a free copy of The Little Book of Breathwork, please send me an email, Catherine@CatherineCarrigan.com, and I'm happy to send you that book. It'll help you breathe better. It teaches you how to use breathing exercises, hand mudras, and affirmations. And so going back to when we are recovering from COVID-19, we have to rebuild. So Dr. Jim Sallis, what is your recommendation for people who had the virus and now they're recovering? So how can we use exercise?
Well, my recommendation would be the same. To be active every day if you can. It'd be probably best to stick with moderate intensity activities. Don't stress your system too much. We know that moderate intensity will help build back your immune system, will help keep your inflammation under control. Because even if you're recovering, you might still be fighting a little bit of virus in there. I don't know. So I think the recommendation is the same. And I've gone even a little farther. We did a paper with some international colleagues about research priorities on physical activity and COVID-19. And one of my recommendations there is we should probably do studies on people after they're diagnosed, and perhaps even when they're in the hospital, of whether there would be any benefit for keeping people as active as they can be. Now, if they're, are struggling with breath and have to have oxygen and assistance like that, well, maybe they're too sick to do that. But if they can tolerate physical activity, if they're active, then they are signaling their muscles to boost their immune system. And that's at a time when they need that the most. And we know that the immune boost, the inflammatory control, and the some of the psychological stress benefits come only when we move our muscles. So just having muscles does not produce these benefits. Moving them does. So I don't see why there wouldn't be some benefit even after diagnosis if people can tolerate physical activity. And I remember back my childhood years in the 50s and 60s, when if you had a heart attack, the first thing they would do is put you on bed rest, because they thought, well, we don't want to stress the heart anymore. That would just damage it further. And now we know that was exactly the opposite of what they should be doing. Now they say the worst thing to do after you have a heart attack is bed rest. And the goal now is to get people up and moving as soon as possible and to keep people moving even while they're recuperating. So I don't want us to make that mistake with this infection. But clearly, some people are going to be too sick to do any kind of movement. So they need the really intensive medical treatment. So it's a matter of deciding who might benefit and who certainly could not benefit.
Now, of course, during COVID-19, many industries have been literally wiped out, such as travel, such as the airline industry. And also, authorities have closed gyms all over the world. Many people are afraid to go back to the gym. And parks have been closed and trails have been closed. If any authorities are listening to this interview, what would you recommend about how we can reopen gyms, parks, and trails safely so that people can take advantage of the health benefits and prevention benefits and recovery benefits during COVID-19?
Yes, I've been wondering about this. Where I live close to the beach, and at the beginning of our shutdown period, the beaches were closed, the boardwalks were closed, the trails were closed, and I was wondering, is that a net positive or a net negative for the infection, for the pandemic? And we've encouraged people to study this and try to figure it out, and we still don't know. But my feeling is that because of the known documented benefits of physical activity, we should be careful about closing places that are generally safe. The outdoor places are generally safe because of what we've talked about. There's more space to keep a distance. There's sunlight that the virus doesn't like. There are breezes to disperse any viruses that are there, and then there's the benefits of being active. So my feeling is that we should keep as many of those places as open as possible. And if there are problems with crowding of people coming too close together in clusters, then we probably need like a park ranger to encourage people to spread farther apart, and to maybe not allow trails to get overcrowded and allow only a certain number of people in at a time. But to keep them open, but to manage them so they're as safe as possible. For gyms, I really feel really badly for the people that run them, because people could benefit by being there, but there's risk, and I think that the risk is real, because if a lot of treadmills are a couple of feet apart, and people are breathing heavy, and all of that, so there's real risk there. So it's, how do you manage it? And there are all kind of protocols that are there now for keeping people separate, for moving as much equipment and classes outdoors as you can, and obviously cleaning and sanitizing equipment. And so there are things that we're learning how to do. So moving outdoors if you can, and keeping people at a distance. So, and I would hope that people would be studying these things to see if there are many outbreaks. And I have seen outbreaks attributed to gyms, but not nearly as many as bars. Or restaurants, where people are close together for a long period of time. So I would like to see gyms opened up as quickly as possible, because for the benefits that they bring.
Now, I know for myself, beginning in March, I moved my yoga classes online, So if you're listening, you can join me for yoga and qigong online from anywhere in the world. Just email Catherine at catherinecarrigan.com and I'll send you the login information. The gym where I go after the lockdown, I talk to them. I'm like, I'm 61, I'm very healthy, but I need to be careful about it. And I was really impressed because they completely changed their protocol. Every other treadmill was vacant, every other rowing machine is vacant. They clean all the equipment between every session. And then they set up a path so that no one touches the equipment except for me. And I agree with you, Dr. Jim Sallis. It's not just that so many people in the health and fitness industry have lost their job. It's that we need the exercise. We need the health benefits physically and mentally, emotionally right now. So the gyms can really be helping people. It's just a matter of, rather than blanketing and closing all of them, having new protocols set up so that everyone can stay safe. Now, you're a health psychologist. How did you get interested in and learn about how exercise relates to infectious diseases?
Yes, at the beginning of this year, I knew nothing about this. I will admit. And this is not a topic that is commonly known, even in the physical activity world. There have been just huge, volumes of reviews of hundreds, thousands of studies about many benefits of physical activity. And these provide the scientific background for our physical activity recommendations. And so we've had two of these really comprehensive review books, and none of them dealt with infectious diseases at all. Just not at all. There were so many other benefits that, just overwhelming evidence, just packed with evidence, but not on infectious diseases. So through an odd circumstance, I got invited to speak at a conference on inflammation, immunity, and cancer. Mm. And in fact, it was being organized by one of my neighbors. And it was held in India. It was planned for India in mid-February. And so I said, oh, that sounds like a great conference. And I hope you've got somebody good talking about physical activity because it's related to inflammation, immunity, and cancer. And he said, no, we're really more talking about diet and supplements and that sort of thing. I said, well, you need somebody to talk about physical activity. So he said, would you do it? Could you do it? And I said, I will try. I will do my best. So I had to go to school. I had to start reading about all of these things. And then I gave my lecture to all of these people studying immunology and inflammation. They didn't know the connections with physical activity. So they were very energized about it. And this is mid-February. So this is when the news of the pandemic was really just kind of swirling. And I said, wait a minute, what I just learned about inflammation and immunity applies to infectious diseases directly. This is how the body responds to an infection. And I was, like I said at the beginning of this, I was alarmed that nobody was talking about it. So I adopted a mission. I need to be Paul Revere. I need to ring the bell and say, hey, everybody, wake up. There's something here we need to know about. So the first thing I tried to do is to summarize these benefits and get it published as an op-ed in a major newspaper. Well, I tried 6 newspapers and they all ignored it. So I said, okay, that's not working. What can I do next? And I have a lot of friends and connections in the physical activity world and the public health world. So I put together an email with the op-ed that the failed op-ed, as I call it, and I sent it to about 100 physical activity and public health leaders around the world, and trying to get some of them to take it to public, our national public health leaders. And I have to say, this has been one of the most frustrating things in my career, because still nobody is talking about it. And we've even tried another op-ed just focusing on the vaccine benefits, because I figured, well, that is urgent right now. And again, rejected by the major newspapers. And again, I sent an email out to 100 people or more, and still nothing. Within the physical activity world, people have said, oh, this is important. We want to publish this as a blog, and we want to interview and that sort of thing. But outside the physical activity world, nothing.
Well,
And
here we are at the Natural Healing Show for UK Health Radio, and we are listening. And I just want to make a comment. My work, I'm a medical intuitive healer. I work with people literally all over the world to figure out, what's wrong with you and what'll work to make you better. I'm a master healer, 27 years of experience. I still teach exercise classes. I teach 6 yoga classes and 1 Qigong class every week. I walk my dog and I garden and so on, because I know the very, very profound benefits, right? I'm 61, I'm not on any medications whatsoever. This is how you stay healthy. And, last question. So Dr. Jim Sallis, you pointed out that when we're exercising regularly, it's more likely that the vaccines will work for us. How do we know that vaccines are more effective for people who exercise? What's the research?
Yeah, there are, let's say, a handful of studies, not a lot of studies on this, but there are a handful, and they're pretty consistent, that people who are active before and during when they take a vaccine, they get a better response. So let me just summarize one study. This was a study of older adults. Remember, this is an issue particularly important for older adults. And so they tested 3 versions of the influenza virus, of influenza vaccine. So influenza is a virus, so there should be some crossover here, or some similarities. And they assigned older adults to 2 groups. One group, they said, we want you to do moderate intensity activity, like walking. The other group, they said, we just want you to do a little stretching, just a little flexibility training, not much at all. So that was kind of the control. They didn't move their muscles very much. And so they had them start a few weeks before vaccine, and they continued after they got the vaccine. And they tested 3 different vaccines. And across the vaccines, the people who did the moderate intensity activity, their antibody response, their immune activation they tested whether it was sufficient to prevent symptoms of influenza. And that rate of sufficient response increased 30% to 100%. Depending on which of the 3 vaccines. Well, even 30%, that is a substantial improvement. And that's not just 30% improvement in antibodies, that's 30% improvement in the number of people who got sufficient antibodies to protect them. And I just think that is so encouraging. That's such an important finding. And it's similar to other studies that it needs to be taken seriously. It needs to be known about. So thank you for helping me get the word out.
You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. And you can find out more about me at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Our guest today has been the very informative Dr. Jim Sallis, Distinguished Professor Emeritus of Family Medicine and Public Health at University of California, San Diego. You can find out more about Dr. Jim Sallis and his wonderful work at drjimsallis.org. And remember, when you exercise moderately and regularly, you're less likely to get coronavirus. Your immune system is going to work better and you're more likely to recover easily. Thank you so much for listening, and we'll see you next time.